Actually, anxiety is a normal human emotion, and a little bit of that anxiety is necessary for us to be able to take care of what we need to take care of. For example, if I don't have any anxiety, or if I have only little anxiety, I wouldn't take necessary precautions to decrease the chance of me maybe contracting coronavirus or any other infection. But when anxiety exceeds a certain limit, it becomes counterproductive. And when it gets to a very high level, it becomes disabling. And we are unable to take care of basically even simple tasks. We utilize adaptive coping skills. And what works for you could be different than what works for me. But we have, generally speaking, common strategies that work for a lot of people. For example, ventilating the emotion, in this case anxiety, could be helpful. How do you ventilate that emotion? By talking about it to someone you trust, for example, a family member or a friend, or even a professional like a psychiatrist or a mental health therapist. Also, writing down your thoughts or your emotions, verbalizing your thoughts using language, written language could be also helpful. Physical exercise. Research shows that physical exercise could be as effective, actually, as medications in helping with anxiety, even clinical anxiety. So physical exercise could be quite helpful. You have practicing your hobbies, things that you enjoy doing, could be helpful. Of course, at this time when, your activities outside could be restricted, or when the gyms are closed, for example, it could be hard to do everything you like to do. But anything that you could do could be helpful. Appreciation of the positive side of negative experiences could also help reduce anxiety. If you think of it, there is no negative experience that does not have positive sides to it. Focusing on the positive sides of that negative experience could also help reduce that anxiety. If you are a religious person, maybe praying or talking to religious figures could be helpful. Accepting responsibility of any negative situation that you find yourself in, or even rejecting responsibility could be helpful. Seeking professional help if that anxiety is out of control could also be helpful. There are so many other ways of dealing with anxiety, and it is really helpful for everyone to explore several options and see what works for them. So I think it's really important to have accurate knowledge. During times like this, it's very common to have all kinds of rumors and exaggerations, and that contribute to exaggerated anxiety and having severe anxiety and panic. It is important to have reliable sources of information. And then also, it's really difficult when everyone around you is getting anxious because emotions are infectious. When everyone around you is also doing something, reacting in a specific way, you might feel under pressure to do the same. It is important at times like this to maintain calmness and to try to think of what you need to do, to try to think of whatever is being done by others is actually right or helpful or not. Try to take care of yourself. Try to deal with anxiety, not to allow it to get to certain limits, certain uncontrollable limits could also be helpful. Doing something positive to the community, to others, if you could also help keep you calm. First of all, it's really important to have structure. The fact that we, a lot of people don't go to work or cannot go to work or cannot really have a lot of social activities outside their residence is something that could be a problem, because people usually, stop doing things that they need to do. And structured activities are very important for healthy mind and healthy body. So it is important, to the best of our ability, to have some activities that are productive, that are meaningful. If you could do anything at home, try to do it, whether it is work-related or not work-related. Again, hobbies that you could practice at home. Try to engage, a lot of us live with, families or people, and try to engage in social interactions with these people. In this age, after decades of having a lot of media resources, people who live together don't interact anymore with each other. That could be a positive side of this negative experience, where we could re-explore maybe family relations and re-explore strengthening these relationships and interacting with people more than before. Of course, around this time, you are at risk also of getting engaged in activities that are not very healthy. Like, for example, watching a lot of TV, or wasting time doing activities that are not very healthy. Try to avoid that as well.